Everybody, this is Ellen Patterson, Support Director with iSalus Healthcare. Thank you for joining us today for our Enhanced Billing Dashboard webinar. I am going to wait a few more minutes just to make sure that I give everyone a chance to come in. So a couple of different things here. All the attendees will be on mute. There is a questions portion of the webinar dashboard. If you could please type in any questions you may have at any point throughout the webinar, and we will get those answered as we can. Also, there are some handouts that are available for you to download. Which are a crosswalk guide and a user guide. So those will be available for you. We will be making recordings available along with those documents following the webinars. And I will be asking some poll questions towards the end of the webinar, and we greatly appreciate your participation. So I am going to go ahead and just give us another few minutes, another couple minutes, and then I'll go ahead and get started. Again, thank you for attending. Hi, everybody, again, and welcome to the Enhanced Billing Dashboard webinar. This is, as I mentioned before, Ellen Patterson, Support Director for iSalus Healthcare, and I will be walking you through our new billing dashboard, which is being released this weekend. If you have any questions, all attendees are on mute, so if you do have questions, please type them into the questions module on your dashboard, and that will allow us to get those questions answered the best we can. There are also some handouts that you can download, and I will be asking some poll questions as we get through the webinar. So I'm going to go ahead and get started here. Hopefully everyone is here who's coming. So as you can see, this is the new billing dashboard. It's very colorful. And it's got a lot more functionality than the previous dashboard did. We put out the previous dashboard 8 years ago, and it had its uses, but now we are finding that there's more things that we can do to make your billing more efficient. So we wanted to do what we could to cut down some time and make working claims more efficient for you. And some of this is based on suggestions from our clients, and some of this are things that we here at iSalus felt would be useful. The first time you come in and enter, you will get your user settings, and there are settings for each one of the sections, and I'll walk you through each of those. And usually with each one of those settings, you'll be able to see a description of what information you get from that. Another thing is with this top section here, the today's activity, you can choose whether or not you want to see it at the top of the screen, the bottom of the screen, the left, the right, or you don't want to see it at all. Plus, you can also choose what tiles are included. You would need to, this box for always display will be checked by default when you come in. You will want to uncheck that, I imagine. You can hit save, and that will save your changes. And then if you need to get back into the user settings, you can either do so through a right click or through using this gear icon in the upper corner and going to user setup. So to walk you through what we have available here, this first part up here, today's activity, is taking information either from today's appointments or from other activity performed today. So just to kind of give you an overview of what's going on. So you have, for example, care team is showing that for today's schedule for this client, there are 6 locations that are seeing patients, and there are a total of 12 resources seeing patients. So give you an idea of how busy. Then you also have new appointments and checked out appointments. So the scheduled appointments for today are 41. And so in this case, you know, of those, there are no new patients. New being that a patient has not had an appointment or a claim within the last 3 years. Also the checked out appointments. Now these are going to be the patients who are checked out. So how many of those 41 patients have been checked out? The eligibility piece, again, is looking at who's on the schedule. And what that is going to show you is, you know, of the patients that are currently on today's schedule, how many of them have had their eligibility checked within a certain date, you know, span of time. Our default is 7 days, so it would show you if any of the patients on the schedule for today have had their eligibility checked within the last 7 days. That number is customizable. You can update that as you need to. Super bills is pretty straightforward. That's just what it says. It's going to be how many super bills have been created and what are the total charges on those super bills. So you'll be able to see what's being created through the EMR by your resources. And I'm going to kind of skip around here because you'll also see claims. And claims is going to cover items that are, you know, created not just as super bills, but also by manually entering a claim or manually creating a claim. So if you had, you know, a certain amount, you'd have, you know, 4 super bills here, but you've also gone in and done 4 manually created claims for hospital services, then you would see 8 here, but only 4 here. So that's the difference there. And then we have our receipts. So the collected receipts is looking at the quick pay window. So how many receipts have been collected and what is the total dollar amount of those receipts? And again, those are for today. The applied receipts are, again, you'll have your created amount, how many were created today. And then the applied amount is how many of those receipts have so far been applied or associated to a claim. So how many of those have you actually gone through the receipt posting process for? And then you have your patient payments, which is going to be any patient payment, whether it's from a quick pay or you know, receipt, whether it's been posted as a statement payment, whether it's been manually posted from billing query, however you have marked something as a payment by the patient or the responsible party. Insurance payments are the same thing. So this is going to be any insurance payment, regardless of where it has been entered in the system. And it will show you how many procedures have had payments and what that total dollar amount is. And then your total payments is the combination of those two. So that is our today's activity. So again, in user settings, you can choose how you want it to be displayed and what of those do you want to see. So if you are, not necessarily concerned about, the appointments, you're more interested in super bills and claims, you can actually go through and uncheck those. You can, choose whether or not you want to see how much has been applied. Maybe you want the breakdown. You can save those, and it will then update your page to show you those ongoing totals. Okay, so our center section here where we have the color, and the one that has the most dynamics to it, is our revenue cycle chart. And so this is intended to help you walk through what the processes are that you need to use for billing. So it is going to show you each stage in the revenue cycle and what is going on with each one of those. So for example, we start with the other thing we wanted to do was make it easier to access the different things that you may need to do. So if, for example, under prepare, I'm showing a dollar amount of claims that need to be prepared. When I click on it, it is going to give me some different items. So it's going to show me missing claims, and then you have claims missing data, and then you have ready for processing. You do have a choice to view these as numbers rather than as dollar amounts. So you can go ahead and select that, and it will change it to how many of each type are missing. And then in each category, you can expand it out and choose to take a look at either the whole section or a part of that section. So for example, here with missing responsible party, I can go ahead and click our view button, and it is going to take me to the account query screen and run a search to pull up for me all of the claims that are missing responsible party. So, and once it does that, you can go ahead and work on correcting those claims in order to get them filed. To return to your dashboard in the upper left corner here, there's a little colorful button that takes you back to that home page. Ready for processing are your claims that are in a ready to go out status. So you can take a look at those. And missing claims, you don't see a dollar amount because there are no, the claim hasn't been created, so we don't know what those charge amounts will be, but we can get a count of how many are missing. So that's our first section there. The next is submit. So of course you have to submit the claims out. So and this is looking at batches. So you have pending submissions. So these are submissions that are waiting in the claim submission area, which have not yet been sent out. Response submissions are claims that where we are still awaiting a response from the clearinghouse, whether that's the insurance clearinghouse or the statement clearinghouse, to see, so they have been submitted within a certain period of time. Generally that's 72 hours, but we haven't gotten any kind of message back from the clearinghouse yet. And then finally, we have our error submissions. And these are submissions where for some reason every claim in the batch has failed. And you would want to take a look at those and find those. So for example, if I wanted to go ahead and see my primary paper claims, I can go ahead and hit my view button. And again, it is going to take me to the submission screen, and it is going to pull up all of the claims that are paper batches that are waiting to be submitted. And I can go ahead and process those, make corrections, do whatever I need to do with those. The other thing in any of these is that under this information, we have the total, the counts, the balances, and it also shows when was the last time that the data was updated. Usually this will be run overnight, But if you want to go ahead and manually run it, you can up here go ahead and do an aging recalculation, and it will go ahead and update that information for you. Manage is where you're going to have all your claims that have other statuses. So your refunds, your crossovers, your rejections, which it looks like for some reason we have no rejections in this database. So it's going to show all of those. And again, the view button will take you to that list of claims. And then you also have no response after 7 days. The 7 days, again, is a customizable setting, and this is for claims that have been sent out where we have not received any kind of response after so many days. So this can be used actually as kind of a start, informal aging, so that you can say, if you hear back from Blue Cross within 14 days, you can go ahead and set your days to 14 days and then see everything that's out there that has, it's been 14 days and there's still no response to the claims. Post is regarding your payment posting. So, and this is going to show you both payments and receipts. So in payments, it's going to show you your manual deposits and your ERA deposits that are awaiting posting, as well as unassociated receipts, which are receipts that haven't even been saved into a batch, and unsubmitted receipts are batches which have not been dispersed. So if I were to go look at my payments and click view, it is going to take me to the payment posting screen. It's going to select what the types, and then I can go ahead and say, okay, yes, that's the search I want to run, and it will go ahead and bring me back those results. It's something similar to when you are looking at the receipts. So it's going to take you to the receipt posting screen. It's going to pop up letting you know that you're trying to search for your unsubmitted receipts, and it's brought you to your batch listing, and so you can see your batches that are considered unsubmitted receipts. So, and again, you can view it as dollar amounts. Any of these can be exported to Excel. You can see when the information was collected and so on. Finally, we have collections, which is regarding our aging. So we have it broken down in here by your buckets. So you can go look at a specific bucket or not. Going ahead and taking you to that bucket, and we do the same thing for insurance and patients, is going to take you to the aging analysis, and it's going to run the search for that bucket. And you can go ahead then and either go ahead and get the detail for that specific bucket, as you can now. But we have also added the functionality where if you right-click, you can get the list of claims in the billing query screen. So if you want to see the claims by provider, I can go ahead and select claims by provider, and that's going to take me over to billing query, and it is going to pull up all the claims for that provider, okay? And it's going to look at all the claims for that provider in that bucket. And you'll get the same thing, you can do claims at intersection, or you can do claims by aging bucket. So if you were running this report on something other than provider, you can get that additional information. And again, you can set, there's a custom setting for you specifically in user settings for that piece under the revenue cycle settings. Under collect, there is a settings piece, so you can go in and set the collection aging options. So if you wanted to, so for example, if I wanted to do financial class instead of provider, I can go ahead and select those pieces and go ahead and say, okay. and save that, and it's going to reset the screen for me. So if I go ahead and go to collect now and go ahead and look at my bucket, it's got them grouped by financial class. But then if I want to go ahead and say, okay, I want to, see the combination of financial class and bucket, I can go ahead and select that. So, that specific financial class, the list of claims, and it is all the claims that are in that specific bucket. So we did add some additional functionality there. Now, if for some reason, charts like this are not your thing, if you prefer numbers, we have two other options for you to view some of the same information. We have what we refer to as advanced, which is going to be the same information, but as as data, straight data without it. You can, when you select something, you can see what those rejections are. For example, you can see a graph for each area. So I can see what my submissions are, what my other claim breakdowns are. I can go ahead and do, claim submissions and see those breakdowns, et cetera. The other option you have is what we refer to as metrics. And these are going to give you some information to comparing a couple of different things where you're going to be able to compare, get a little indicator as to whether or not, for example, that your aging is down from the last date that it was checked. So it's going to go ahead and give you that information. And again, each one of these sections has their own user settings under advanced and metrics. So you can choose which settings you want to see, whether or not you want to see the pie chart, and the different sections. So you can choose what you want to see under there. So our final section here are key performance indicators, or KPIs. These are going to give you some graphing ability to kind of track over the things you're doing. So for example, if I wanted to go ahead and look at payments versus charges, I can go ahead and do that. So I've got payments and charges and payments. I can hover over the data points to see what is going on with those. If I want to see more detail or look at a different date range, I can go ahead and expand my KPI section, and it is going to show me, a great increase in things. I can zoom in for 1 month, 3 months, 6 months, year to date, everything. So I can go through. I can set specific date ranges. I can also, if I wanted to, for example, add charges, payments, and claims, for example, now I've actually got a double axis. So it's going to show me, because claims is going to be a count versus a dollar amount, it's showing me, so I have my count on the axis versus the dollar amounts for charges and payments. You can also expand your date range here visually. You can scoot it so you can zoom in on a different section. So all of that's available. The reason that the AR, date of service, and AR aging are off separately is because they are different kinds of graphs calculated with different information. So they're going to go ahead and show you that information when you hover over it. Okay, and then the yellow stars here are the ones that you will select in order to determine what are your favorites going to be on the home page. So you can choose, you may have up to 6 total selected. You must have at least 1 selected. You have all that, and then of course we also have the ability to download the image and print the chart. So, and of course, again, there are settings for all of these. That is the meat of the dashboard. Again, if you have questions, please type those in and we will get those answered. I'm going to go ahead and mention and send the first of the poll questions. So we'd really appreciate if you go ahead and answer that. Okay, anyone else? Okay, so we've got that. Since there's still no questions, I'm going to go ahead and ask our second poll question. Okay. And our final poll question. Okay, anyone else on the last question? Okay, so I did get one question here, and I'll go ahead and answer that for everybody. What is the easiest place to find a listing of patient names and amounts owed? And that easiest place would be under our collection area. We have our patient aging, and you can choose to view it all at once, or if you want to go through and view just specific sections, I'm going to do, rather than the whole thing, I'm going to do one that's a little smaller here. So that is going to go ahead and bring back, and you'll see the patient information here. And then what you can do is go ahead and select your list of claims by financial class. So it's going ahead and getting me that list of claims. And these are all claims where patient owes the balance, and it's going to have the balance on their claim. And of course, you can go in and view the patient history on any of these claims. to see everything that's outstanding for that patient. So we have all that information very easily. It's much easier than running these searches separately as you have been. The next question I have is the best place to find a listing of all the deposits for month and the patients associated. That hasn't changed from before the dashboard. That information is going to be generally done through either the reconciliation report, or you can actually run the report through your payment posting screen to get everything from a certain date range that has been dispersed and to get the breakdown for those pieces available. So if I were going ahead and just looking for items that have been dispersed for, and then they were with deposit dates, and I'm going back a little bit because this is our QA section. Okay. And that's going to pull back my list, and it does exceed my rows. And then if I need to, I can go ahead and get an actual report of all of those items. So just to reiterate, the only thing that is changing in this release regarding billing is the dashboard. None of the claim filing processes will be changing. None of the statement processes will be changing. You will continue to do those as you have been doing them. So what we are trying to do here is give you more activity at your fingertips so that you can find your claims easier. But as far as actually processing things like statements, what we've got is just, it's going to be something easier as far as, you know, for example, ready to send and sent statement claims. Instead of having to go pull a manual search for those, you can go ahead and pull those claims up, you know, directly and then walk through your normal statement process. So, any other questions? And I think this is probably too big a list and why it's taking a long time to come back for our poor little quality assurance system. So if there aren't any other questions, I'm going to go ahead and wrap up. You know, if you have any future questions, please go ahead and let us know. You can do that by either putting in a support ticket or sending an email to support@icelishealthcare.com. And we will be happy to answer those for you. And this is going to be available for your use either Saturday morning if you have to be with the practice that sees patients on Saturdays, or on Monday. And we will be here to answer those questions as the process goes. So we want to thank you again for attending today's webinar. Again, you can get the handouts downloaded from the handouts area. You can also you know, we will also be sending out recordings or putting out links for recordings and sending out a list of FAQs and the appropriate answers. So again, thank you very much for attending. Have a great rest of your day. And thank you for using iCelis Healthcare. Bye-bye.